your concern?
My concern is, we're recording. My concern is, if you start mentioning names, our channel's going to get strikes and get taken down. That's my concern. We're having an argument because we're recording now, obviously.
John, I have 7 or 8 drugs here. I won't mention a name. We'll call them A, B, C, D, E.
But they're all functionally the same. They're going to cure eczema, right?
And I'm not going to tell you which manufacturer or anything, but they
exist. It doesn't matter. They're all in the same bucket.
Can I also say that what I'm reading to you are published reports of the way they studied these drugs in the New England Journal, in JAMA,
absolutely.
But I won't mention the name of the drug.
No question. Absolutely.
Fine. I can mention JAMA, and fine.
Yeah.
Because at the end, I want to vilify them in a scientific way.
Knock yourself out.
Okay.
But vilify them as a class, not
I want
by
to
specific
vilify
drugs.
them also that there are 60 doctors working on this drug. How dare you do this?
Our viewers are getting a scene of you and I arguing behind the scenes on a regular basis. Because if the channel gets struck, we're done. We don't reach anybody.
You think that could happen?
Yeah, hell.
You really
are you kidding? Coming on this channel and saying that XYZ drug is ineffective and it's essentially a fraud? Yes.
In my experience, I'm seeing the patients. They're coming to me for cyclosporin.
I got it.
That's bona fide. That's not illegal. That's not, to be attacked by a lawyer.
Yeah.
My experience.
I got it.
Okay, is that okay?
Yeah, that's okay. We're just not talking about drugs that are the injectables, the big guns, what is it? The $18,000 year guns.
What do you mean we're not talking about?
We're not talking about their names. We're talking about about the testing that goes into it.
Fine.
And it says how many drugs are now in development for eczema?
I think that they're approved.
Approved. How many?
I have 8 of them. 8 of them.
Yeah.
You know they're going to be at each other's throats. They're in every fucking derm office. Or they figure out, we'll just hit the Northeast. Let Dupixent have that over there. We'll be satisfied with the money we're making here. Well, at $60,000 a year, you don't need very many patients.
Right. You got to make that money before it goes off patent.
You're all going to die in California because there's a drought. You all need to be on my drug for the rest of your life because eczema, you have bad eczema for the rest of your life.
Yeah.
If you don't do, Mr. Asthmatic, if you don't take my drug, you're going to die. You know that peanuts aren't allowed on airplanes because of people like you who are allergic to peanuts?
See, the sales point of these drugs, though, is that I would pretty much guarantee that every single person using these drugs have climbed the ladder. They're on full strength clobetasol. They're completely a disaster, and now they're reaching for these next big drugs, right?
Well, and in here, the reason I'm pushing is that I'm going to tell you, everyone, steroids were allowed during the study.
That just is ridiculous.
It's ridiculous. So the data shows maybe a little bit difference versus placebo. They never had to stop the medication because they quelled any horrible flare with allowing steroid. And there was enough allowance on the placebo side versus the drug side. The drug maybe did some good things, so that there was a difference statistically. If you're giving placebo called water or just the base versus drug that might have a little bit of benefit or whatever, slam dunk, you're better than placebo.
I mean, that measure of improvement then is so subjective that it almost seems irrelevant. It is irrelevant.
Well, tell me what the criteria do they use? All subjective. Itch and sleep. Oh yeah, I'm sleeping much better. On a rating of 0 to 10, what do you think? When you first enter, 10, bad. Tell me after 3 weeks, what's your rating? I think an 8. Oh, already 20% better. Those fuckers. And they would use that data and show how different it is versus placebo. Itch, the same thing. How's your itch? Oh, yeah, I'm not scratching as much. What do you mean? Oh, it's a 7 versus the 10 when I came in. How'd you make that up? Well, I got 30% better now. And that's the only data they had. Guess who made up the data? 30 years ago.
Data as far as what?
Itch, burning, sleeplessness, anxiety, oozing, and edema.
So you established the benchmarks.
And they never gave me credit for
the
it.
benchmarks.
Yeah. They never gave me credit. They plagiarized me in everything. And in the studies. And you can tell also that in the ads they can't say anything more other than it helps itch. They look better. What kind of scientific study is that? What, are you kidding me? And
Well,
you see a couple young girls.
Oxycontin helps itch too because you're passed out, right?
Yeah.
Fentanyl helps itch.
Of course. You're dead.
You're dead.
No itch.
So if I could interpret your anger for our viewers
Are we on?
a little bit.
Are we
yeah,
on?
we're on.
Oh, I didn't realize.
You didn't?
No.
So you would have been dropping the F-bombs, is that it?
No. I try to be
If
scientific.
I could interpret your anger for just a little bit, part of your anger is being on these drugs is just prolonging the inevitable of having to go off steroids, right? It's another period of time that you're going to be miserable.
No. I'll tell you better. I'm angry, but I go like this. Guess what? Dupixent hasn't cured one person in 6 years. They're still on steroids. They can't be cured if they're still on steroids. Don't you see that?
So
Mr. Doctor.
The misdiagnosis of yes.
Helps.
Okay, right.
So they're never going to be cured.
Right.
And there's been no paper about cure. Only a little bit better. Oh, we can bullshit. They're still on steroids. Whenever they have a flare or a problem, they grab the steroid tube. They're allowed. And they're functioning better. Okay. But they're still on steroids. So they're never going to have a paper about cure. That's number one. Number two, that's the main thing. That it's great for us. We're not going to have to fight about anybody because they're never going to work. So they're going to ultimately, which has happened at least, I'll make up a number, 200-300 times, they have failed on Dupixent. They stopped the Dupixent because it's not working, and they come to me for the cyclosporin.
Well, that people can see that in the comments, and that comment that you just made. If anybody doubts that, go look at any of your videos and read the comments, and you'll see that. I've been down that route.
Yeah. So, and they're being told by their doctor, oh, you got to give the Dupixent more time. It's 6 months to a year. What drug takes 6 months to a year to cure you? What are you talking about? If it's really a curable drug, a curing drug. It's a game, but the game, that's why I haven't even mentioned it to you. I was waiting to talk about the drugs and comment that they're all on steroids. Number one, the studies were horrific because they allow them to stay on steroids and never mentioning how much. Whatever the doctor wanted, it was allowed. It was okay, a little bit to help them get through their flares. What do you mean? Who ever heard of a scientific study where you were allowing another drug to be used at the same time? Yeah. It should be pure.
Yeah, a heart plaque study with people on antistatins, right?
Yeah. You're crazy. So the criteria on scientific papers has changed radically, and I'm telling you, I won't go in detail unless you want me to, with all the different drugs. Everyone were on steroids. They also were 3-month studies, big deal, doesn't really prove anything. And they were using all kinds of code names for redness, for a little less itch, for a little, to build up a number system versus placebo. And look, our numbers were much better than, and we got approval. And the New England Journal, and JAMA Dermatology, and the Journal of the American Academy of Dermatology published the papers. Every study was needed at least 20 to 40 doctors to supply 1 to 3 patients in order to get that 800 number, 200 number, et cetera, et cetera. Every study, they would screen, I'll make it up, 300, and they would accept 175. Who were the ones they didn't accept? But they were that red or that bad?
Or they may have diabetes. There's a number of reasons.
There were that. Everyone, I looked at everyone. The average age was 37 to 39 years of age. Eczema burns out at age 7. They were all addicted. They had the wrong diagnostic criteria. They were not eczema people. And a couple of psoriasis people were stuck in. They didn't realize they were taking care of those chronic users.
That's interesting.
Yeah. Yeah. I've had about 7 psoriasis patients as they finally get rid of the steroids. Oh my God, they got psoriasis. It's effaced after 10 years of using the steroids. And they say, I think I had eczema, I was itchy, whatever. So everyone was the wrong age. How's it possible? That's not the routine. Everyone was used by their doctors, and you won't let me mention names, but I will someday. I'll get them. They gave up their patients as guinea pigs for these studies.
We know who they are, right? You're talking about the doctors that gave up their patient. Well, we know who it is. Or who they are.
Yeah. Always a fancy institution.
I got it.
Or hospital.
Yeah.
There was one dermatologist back east who in 2019 or 2020 made $300,000 that year in doing studies and giving lectures on top of her academic salary. Not appropriate. Not appropriate.
It's the proverbial horse with the fishing rod and the carrot hanging down in front of it. We perpetuate what is diagnosed as eczema as chronic steroid addiction, and then we look for drugs to treat an addiction, not the underlying diagnosis. Lather, rinse, repeat, right?
I don't know how or who in the drug company allowed these things to go on and studies to be done and marketing to go on, and millions upon millions are being spent, and it's wrong.
That's easy. Oh, that's the easiest answer in the world. They don't know what topical steroid addiction is.
Why?
Well, I don't know. That's another question.
Well, I'd like to hope and think that our continual bombardment with these things, with the use of cyclosporin to cure chronic addiction, will wake up the drug companies and see that their drugs are valueless. Valueless. But already, I'm not sure what it means, but in dissecting the drugs and pulling all the papers that I could, already, this drug was started first for psoriasis, but we're going to do a study in eczema patients. Well, this really was started for eczema, chronic eczema, but we're going to do a study in asthma patients. So they're already looking for other avenues to sell this medication, maybe knowing that it's not appropriate for bad
neuropathy is going to be next, or whatever, right?
Yeah.
Well, let's just keep going. We'll keep doing these videos, and now we will begin.
Okay. Tell the public where that comes from.
That's from Portnoy's Complaint, isn't it?
Portnoy's Complaint, Philip Roth. He goes through the whole 300-400 pages of moaning and groaning about his family, his parents, and all that. He finishes, and the Viennese professor with a German accent says, "Thank you very much, and now we will begin the therapy."
All right. Well, until the next time, please like, share, subscribe. Dr. Rapaport, thank you very much as always.